Hey beautiful people, welcome and welcome back again to the channel. It's Dale here and I am your captain. Today we're going to be talking all things career progression here in Australia. If you're just seeing my face for the first time, hello, my name is Dale Goodness and I am a registered nurse currently practicing here in Australia. On this channel I share my life in Australia, my nursing career, and just bits and bobs here to assist you moving to Australia and just share my knowledge. So if this looks like fun, please make sure you subscribe and join the family. Now, the career progression for nurses here in Australia is quite similar to the UK, but let's talk about it, okay? If you come into Australia and you want to be a nurse, you are either going to go through the EN pathway, which is like the diploma in nursing pathway. So you go to TAFE, it's called TAFE, and when you graduate, it is a 2-year course. You get to graduate with a diploma in nursing and you have a license called enrolled nurse, so EN. Now, enrolled nurses practice within their scope of practice is quite different from the RNs, which are the registered nurses. And for the registered nurses, they go through universities, and when they finish, they graduate with a Bachelor of Science in Nursing. Okay, and I would also like to put it out here that in Australia, we don't have the same kind of nursing in the UK per se. We don't have pediatric registered nurses here, we don't have mental health registered nurses here, we don't have disability nurses here, we don't have adult nurses here. If you graduate from university here in Australia, you are a registered nurse. All of us are registered nurse. I can work in mental health today. I don't need to get a new PIN, I don't need to write a different exam. I can decide to work in pediatrics as long as I have an employer that's willing to sponsor me. I don't need to get a new PIN, or you know what I mean. So it's RN for everyone. So when you graduate with your RN, you start practicing as a registered nurse in Australia. You can decide to do a graduate year in Australia. So graduate year is 1 year after graduation. So you are being placed in a particular specialty and you have to like apply for these roles. Okay, it's like applying for a job, but it's like a graduate year. So if you go on Indeed, you see all those kind of roles, so you can apply in any specialties, and when you pass the interview, you do all the whole process, you get a job, you are going to practice in that field. Okay, now when you get a graduate year in, let's say, perioperative, and you are doing scrub nursing, you practice as a scrub nurse for 1 year, and after 1 year you are no longer a graduate nurse anymore. You just automatically become independent. But during that first 1 year, you're going to be working together with a mentor for 1 year. Okay, as much as possible, you're not allowed to work alone because you are under preceptorship. So yeah, you're not allowed to work alone, but you don't know how short you are. Anyways, after that, you can now start looking at going for advanced roles. Okay, now most of the advanced roles here in Australia, after your RN level, when you feel confident, you can start applying for, either you apply for a nurse educator or you apply for a nurse specialist. So specialist nurses, we call them CNS. You can be CNS in any field, okay, any field at all. You can be CNS for heart failure, you can be CNS for acute medical, you can be CNS for anesthetics, you can be CNS for anything, like literally anything, as long as you've worked in that particular role for 2 to 3 years. Usually they will say 3 years, but I've seen people move up after 2 years. Okay, you apply for those roles. So like CNS is like the next level after you being an RN. Okay, so when you get to your CNS role, you work as long as you want, and most of the times after 2 years you can start applying for the nurse consultant role. Okay, so the nurse consultant role is the next step after CNS, and it is like a more advanced role. So most of the times, if you want to go for your nurse consultant role, you would need to have like at least a graduate diploma. Okay, most of them will ask you for a master's in nursing or master's in that field, because you can have so many masters. You can have masters in anesthetics and recovery, you can have masters in respiratory therapy, like masters in anything. Because I just feel like the opportunities here are endless, so you just have to make your way out. But sometimes you can get that role with good experience and you can get it with a graduate diploma. So if you finish school, you can either do your graduate certificate, you can do your graduate diploma, or you can do your master's degree. Okay, of course you can go ahead to get your PhD in nursing, because if you want to be a lecturer or you are going into research, you can go further to have your PhD in nursing. Okay, so basically these are the 4 advanced courses you can do. But let's go into the more interesting clinical roles. Of course, we know we have our nurse managers, all those things. I'm not going to go into details because we know all that. So what next after you have been a nurse consultant for a while? If you feel like you need to move up, you can go up to become a nurse practitioner. Now, who are nurse practitioners? Nurse practitioners are advanced, in fact, not just advanced, they are the only legally accredited advanced nursing role here in Australia. So their license is like legally protected, so they can assess patients, not just assess, advanced assessment. They can order investigations to go on, like diagnostic investigation. They can order x-ray, they can order ultrasound, they can order CT scan, they can diagnose as well within their scope, of course, and they can also prescribe medications. So they're the only protected advanced role here in Australia. So how do you become a nurse practitioner? You can be a nurse practitioner in any field at all. Okay, so you can be a nurse practitioner in cardiology, nurse practitioner in pain management, anything you want, as long as you have been in that field for about 4 years. Okay, hear me, 4 years. Within that 4 years, you must have practiced as an advanced nurse for 2 years. Okay, so you've been in the medical world for 2 years, and after 2 years you feel you want to be an advanced nurse, you go over to become a nurse specialist, nurse educator, and after 2 years as an advanced practicing nurse, you can now enroll to universities. There are not a lot of universities offering NP at the moment, because NP is quite new to Australia. I think the first endorsed NP started in December 2000. So this is about how many years now? 24 years now since nurse practitioners started practicing here in Australia. And I think they have over 2,000 plus to 3,000 plus enrolled NP. So it's quite new in Australia. Okay, another thing I would like to say is that you have to look out for the school requirement. Most of them have similar requirement. They will need you to have worked in that area for 2 years and extra 2 years as an advanced nurse in that same area, and they will need you to have practice hours, need you to have lots of other things. You can look it up. I probably will do a separate video about that. But yeah, you can practice an MP in any area, and the MP will give you a master's degree. So you're going to be a master's in nurse practitioner, and that will be like for 2 years if you're doing full-time. But if you're doing part-time, it might be up to 3 years, and it depends on how much you want to pack your courses anyways. But usually when you apply for your NP, they would need you to have like a post-grad certificate or a post-grad diploma. Most of the schools I've seen, that's their requirement, and some of them will say, oh, if it's good if you have a master's degree. So overall, you need about a minimum of 4 years in a particular field before you can apply for NP school here in Australia. Okay, which I think is good because it prepares you for the task ahead. Becoming a nurse practitioner is really a big thing. It's an advanced role. It means you're going to have caseload of your own patients. It means you are going to see patients yourself with minimal supervision from any doctor. So I think it's something that you should be in that field for a while, know the kind of patients you see before you even practice. And trust me, the process is quite rigorous. I mean, you need to practice for 5,000 hours. I mean, they have requirements. Before you get endorsed as a nurse practitioner, you also have to sit for the board exam. So just like we sit for RN exams, you have to sit for the board exam for NP, because it's like you're going out of an RN. You're no longer an RN. You're going to have a new PIN. You're going to have a new letters to your name. You're not going to be putting RN anymore. You're going to be putting NP, which is higher. So yeah, that's it. After you become a nurse practitioner, if you want to go over, now you go over to do your PhD, so you can be a doctor in research, or a doctor of philosophy, doctor of PhD. So yeah, those are the career progression for nurses. I hope you find this video useful, but let me know what you think about the career progression. I didn't go into most specialties that we have. We have almost all the specialties you think of in hospital nurses. We have the cardiology nurses, acute care, perioperative, we have the pain management, research, yeah, we have all of those things here, but all of them start as RN and then you move up, as I've said. So let's recap: EN, RN, CNE or CNS. So it's either you do one, you can be a nurse educator or you can be a nurse specialist. So if you want to go through the education route, you just go straight. If you want to be a specialist in clinical field, go for your CNS. After CNS, CNC. So CNC is the nurse consultant. You still do advanced things. When you are a nurse consultant, you do more than just an RN or just a CNS or CNE. It's quite higher, so your scope of practice is higher, salary is higher, you know, everything's higher, so they expect more from you. And after that, you can go on to do your NP and your PhD. Okay, so let me know if you have any other question and I'll be happy to answer. Thank you so much for watching, and I hope you find this video useful. I'll see you guys in my next one. Don't forget to hit the like button, subscribe guys, subscribe. I want to get that silver play button, so make sure you subscribe to my channel and let your friends know about my channel as well. I'll see you guys in my next one. Bye.